Diabetes in the Filipino population. Did you know there is an increasing prevalence of type 2 diabetes in the Filipino population? Filipinos are at a higher risk of developing type 2 diabetes despite having a lower body weight compared to Caucasians. 2 out of 3 adults with diabetes die from a heart attack or stroke. Adults with diabetes live 7 to 8 years less than adults without diabetes. What is diabetes? Diabetes is simply having too much glucose or sugar in your blood. Your body always needs some glucose because our bodies use it for energy. But too much is not good. Foods high in sugar include ice cream, cookies, cakes, but also foods high in carbohydrates such as bread, rice, and pasta. What causes high glucose levels? After eating carbohydrates, carbs are broken down into simple sugars called glucose. Beta cells in our pancreas detect the high levels of glucose in our blood and respond by releasing insulin. Insulin is a hormone that works in a lock and key manner. By binding to insulin receptors on a cell membrane, insulin facilitates the transfer of glucose into cells so it can be used for energy. Without insulin, glucose would remain in our blood, resulting in high blood glucose levels. What is the difference between type 1 and type 2 diabetes? Type 1 diabetes is when the pancreas does not produce any insulin. Beta cells of the pancreas that are responsible for producing insulin are destroyed by the body via an autoimmune response. Type 2 diabetes is a combination of the body not producing enough insulin to keep up with the demand and our cells become insulin resistant. What are the signs and symptoms of diabetes? Urinating often, feeling very thirsty, feeling very hungry even though you just ate, extreme fatigue, blurry vision, cuts and bruises that are slow to heal, tingling pain or numbness in your hands and feet. Diabetes affects many of the major organs in your body. It affects your kidneys, eyes, nerves, skin and mouth, feet, but most importantly, diabetes affects your heart. How does diabetes affect the heart? Diabetes accelerates atherosclerosis. Atherosclerosis is the buildup of fatty deposits such as cholesterol in the blood vessel. If blood vessels that supply your heart and brain are narrowed or blocked, then blood supply is cut off, which may lead to a heart attack or stroke. What are the warning signs of a heart attack? Patients may experience chest pain or discomfort, pain in the arms, jaw, back, neck, or stomach, shortness of breath, sweating, palpitations, and nausea. You may not experience all of these symptoms and they may come and go. Chest pain that doesn't go away after resting may signal a heart attack. Diabetes can cause nerve damage that can make heart attacks painless or silent. Remember your ABCs to prevent heart complications. Ask your healthcare provider about the best target A1C for you. Generally, an A1C below 7 is ideal. The American Diabetes Association recommends a blood pressure below 140/80 for all diabetic patients. Cholesterol. LDL and triglycerides clog blood vessels and increases the risk of heart disease. HDL protects the heart and lowers the risk of heart disease. It's also important to make smart food choices. Changing what you eat and how much you eat can make a big difference. Eat at least 5 servings of fruits and vegetables. Limit saturated fats found in fatty meats, poultry skin, butter, whole milk, and ice cream. Control your weight and be more physically active. Reduce the number of calories you eat smaller portion sizes, and aim for a total of 30 minutes of aerobic exercise, such as brisk walking at least 3 times a week. If you smoke, it's important to start making steps towards quitting. Smoking is associated with many health conditions. Quitting smoking not only will help better manage your diabetes, it will also greatly reduce your risk of cancer and improve your overall health. Aspirin may help lower your risk of heart disease. Ask your healthcare provider whether you should take an aspirin daily. Why are Filipinos at a higher risk for diabetes? Genetic and environmental issues are the main causes for a higher prevalence of diabetes in Filipinos. A study by Araneta and Barrett Connor found Filipinos to have a higher prevalence of diabetes compared to Caucasians despite having a lower BMI. This study found Filipinos to have higher amounts of visceral adipose tissue. Having excess amounts of visceral adipose tissue has been positively correlated with an increasing risk of diabetes. Despite the numerous diabetic medications available on the market and the various diabetes centers, majority of patients with diabetes fail to reach their target glucose goal. Many of the challenges surrounding Filipinos are related to cultural barriers. White rice is a staple in the Filipino diet. Substituting white rice for brown rice is an excellent alternative. Filipinos also often attend many family gatherings with foods that may be high in sugar. Some helpful tips include don't attend gatherings on an empty stomach and eat a small snack beforehand. Also, Filipinos value family time and have difficulty incorporating exercise in their daily routine. Try making exercise a family activity, such as riding bikes or taking brisk walks after meals. Filipino dishes are often loaded with salt and are high in fat. Examples include liver or other organ meat, shellfish, lechon, bagoong, which is high in salt. Ampalaya, milkfish, kangkong are healthy alternatives which are diabetic friendly. If you don't have diabetes, you may still be at risk. A study by Morales and others found 18.6% of Filipinos have metabolic syndrome. Metabolic syndrome is a combination of high triglycerides, impaired glucose tolerance, diabetes, high blood pressure, and high uric acid. Metabolic syndrome is positively correlated to increasing a person's risk of type 2 diabetes and cardiovascular events. So what can you do to be proactive? It's important to create an action plan. If you've been diagnosed with diabetes, it's important to stay compliant with your medications. Your healthcare provider may prescribe oral medications such as metformin or insulin, which is administered as an injection. Keep your A1C, cholesterol, and blood pressure at a healthy level. Follow a healthy eating plan. Be physically active most days of the week. Check your blood glucose regularly and bring your blood glucose records to each appointment. Check your feet every day. Have a dilated eye exam every year, and aim to lose 2 to 4 pounds per month if you are overweight. Call your healthcare provider if your blood glucose is less than 70, if you're nauseous or persistent vomiting and unable to keep liquids down, if your blood glucose is greater than 300, or you are unsure how to manage your diabetes.